Probably one of the most concerning features of aging in men specifically is the gradual thinning and potentially the ultimate loss of hair. The question is this a natural progression with age? Is this something we should just accept? Or in fact, can we do something about it and perhaps reduce the rate at which we lose our top end? Men certainly have drawn the short straw. You see, men have a hormone called testosterone, and this testosterone level with time has an effect on the actual hair follicle themselves. Essentially what happens is that the testosterone converts or is converted to a rather toxic secondary hormone called dihydrotestosterone. And unfortunately, over time, this dihydrotestosterone is responsible for the miniaturization or the reduction in size and activity of the follicle. And in fact, left long enough, dihydrotestosterone may even kill the follicle completely. Hormonal changes, thyroid hormones for example, certain medications, lifestyle, all have an influence on the health of the scalp as well as the follicles from which the hair grows. It's very important to recognize that hair, much like any other part of your skin, requires a healthy environment in which to grow and to mature and to remain healthy. Anything that will jeopardize that environment may very well affect hair, not only in its appearance and its vitality, but also in its thickness and ultimately the thinning that may ensue. The question of whether a hair follicle actually dies. Well, indeed, if you look at an individual who has lost all their hair and is completely bald, the answer is yes. The follicles have in fact died and they have reached a point where they cannot regenerate new hair fiber. The problem here is that trying to then use topical ingredients to block the devastating effect of this dihydrotestosterone is a little late. Ideally, as one notices hair thinning, you could intervene with effective therapies that minimize the impact of this dihydrotestosterone hormone. So what's new in terms of topical hair loss prevention? Well, we've mentioned the caffeine. There are prescription drugs which can be applied onto the scalp, which can also try and reduce the effect of this testosterone conversion. But there are certainly newer peptides as well, found in solutions, conditioners and shampoos. These new peptides are able to physically increase new follicle formation. Although still not protective against the effects of testosterone, they can certainly induce more hair follicle development and ultimately hair growth. So this is a big step forward and potentially may even be combined with these medical therapies in order to enhance or optimize hair growth in thinning scalps. So if you are one of those individuals who's noticing a gradual thinning of your hair, I think it's rather important that you first stand back and reassess your lifestyle. Are you eating healthily? Are you engaging in regular exercise and activities which will enhance blood flow and circulation? If the answer to all of these is yes, yet still you're suffering with this concern, it's worthwhile perhaps paying a visit to your doctor. Sometimes a quick check of your hormones might be all that is necessary to determine whether there is a medical condition underlying the thinning of the hair. If, after all of this, everything is still normal, and hopefully it is, then you could consider the range of treatment options from either oral therapies, which your doctor would have to prescribe, to topical therapies. Now, these topical therapies can enhance new follicle growth, new follicle development, increase blood circulation to the hair follicle, and in some instances even negate the harmful effects of the male hormone testosterone in the scalp. Together, this means that in the future hair growth should be well sustained beyond the average age, provided that there is no underlying medical condition.